So one of the most common diagnoses that all of us are dealing with and struggling with in the therapy world is dealing with the diagnosis of dementia, Alzheimer's. As we know, you have to pull out a different set of tools for that diagnosis because our traditional Therex isn't going to work with them, right? Not able to follow the commands. But we can do a huge service to them and appropriate therapy if we're just using tools that actually work for them. And Recovo is perfect for them. So I'm going to give an example. We're going to bring my friend in here. One of the important things is remembering that when we're cueing these patients with the diagnosis of dementia, we have to use a lot of visual cues and items that explains to them what we're doing, because your traditional asking of tasks and exercises isn't going to work for this population. So we're just going to simulate it. And what we're doing is we're going to use Recovo to actually have her do something that's an old life skill that she hasn't forgotten. We're going to give her cues with the paintbrush, and we're going to have her paint a picture, because she can remember to do that. She won't be able to explain who it is, but art and music are the two areas in the brain that's never affected by dementia. So Recovo is perfect for this patient population. When you're trying to get compliance and participation, this really makes a difference. So I'm going to let this patient know, hey, don't forget to use your cues. Hey, how are you? I'm going to let her know I'm friendly, because I'm going to put this on her arm. And she needs to know why I'm sticking something to her, right? So I have to get her compliance. I have to make sure she feels comfortable with me. Hey, are you doing all right today? I have a little thing I'm going to put on your arm. It's going to be okay, all right? So, oh, it makes a lot of noise. So as we're doing it, you're just going to let them know, because they're going to be wondering what that is. And as we're doing it, I'm going to cue it to start. But I'm like, I love to paint. Don't you love to paint? Yeah. So I'm going to give you a paintbrush. Do you want to paint our paintbrush? I'm going to cue her to let her know. So she's, wow. Yeah, that's good. Now, a lot of times we have to watch her balance. So at the same time, I'm going to stand close enough to her so she is losing her balance, because they might get excited to it. But they're going to get engaged in it, right? And then there's a lot of things we can do with that. I can do some weight shifts with her. So as she's painting it, I'm actually challenging her balance. Same time, as long as she's receptive to me, we can actually start off the whole picture making circles, or we can help them create their name. So if my name is Lisa, I go L, and then I, and S, and A. You can just play with it. But what happens is, now I've had a client standing there for 10 to 15 minutes. She's engaged. I'm not asking her to do things that with the dementia diagnosis she's not able to process. And when I'm using my functional measures, you know what? When I'm done with this, she stood for 10 minutes. Standing tolerance equates to ADLs and functional tasks. She's more able to do things that decrease fall risk, especially if I'm challenging her balance. So at the same time as I'm working with her, doing weight shifts. Remember, compliance is one of the best benefits of Recovo, and making sure they actually participate and they're engaged.